All right, thank you so much for staying with us. We're talking about the unending health crisis here, and joining us now is Peterson Wachira, is the chairperson, Kenya Union of Clinical Officers. Now we're getting the end-to-end conversation of this entire health crisis. Seth Panyako is here, is the Secretary General, Kenya National Union of Nurses. Mwachonda Chibanzi is joining us online, is the Secretary General, Kenya Medical Practitioners, Pharmacists and Dentists Union. Earlier on, the Governor Lee Kinyanjui sent in apologies, is not able to join us for this conversation. Wachira, before you came in, we were just talking about why is it so hard to resolve the medics issues here, and who is fooling who between the county governments and the national government. We've seen the return to work formula now being reneged on, and the county governments are simply saying we don't have the money and the return to work formula should be county specific.
Yeah, thanks Trevor, and thanks for having me. And let me say that I think there is insincerity from the Council of Governors. First of all, when we started this and we gave our grievances, even before we went on strike, they came out and said that what we are having on the table, we as the counties, we cannot be able to solve. This is a problem that the national government has to come in to be able to give a solution. So the national government took it up. Under the Ministry of Labor, they then constituted a multi-agency committee with all the departments in the country that can actually be able to make the decision on the table. The National Treasury, SRC, Ministry of Public Service and Gender, Public Service Commission, Federation of Kenya Employers, KOTU, the unions, Ministry of Health, and the Council of Governors. Then we were asked by the Ministry of Labor, can you send people with mandates, with capacity to be able to make the decision? And so we all sent our people, including the Council of Governors, and they came together and sent people as the 47 county governments. Then we sit on the table, we make a decision, all of us as the multi-agency, including them. So if it's an issue of resources, the Treasury was on the table. SRC was on the table. So the counties, after making this decision together, they cannot then go back and say that we were not involved when they were actually on the table, and then go back on what we had agreed and say that now we cannot be able to sign because we do not have the money to implement. And I saw, I think, the tweet by the chair yesterday saying that he doesn't have the money for the risk allowance and to pay the compensation packages for those who die. You can imagine a situation where you are told, number one, you know, we are complaining that we don't have the right PPE. When you fall ill, especially if you have been employed by the county governments directly, because that means that you do not benefit from the comprehensive medical insurance cover, it means that you don't have a cover. Then you don't have a cover, we have to contribute for you. Once you die, your family has to live in destitution. And they are saying this, and they are saying in public. And then they ask us, can you go back to work? And if you are not going back to work, we are going to sack you. So we are in a very hard situation where you know the situation is dire, the working environment is not safe, and even if you are to succumb from it, you cannot be compensated. So I think there is insincerity because the ministry has come out, in our return to work formula, the Ministry of Health gladly signed on first, I'm sure you saw it, and they are very okay with it. So I'm wondering why the county government should actually have a problem with it.
They're simply saying they don't have the money.
But the Treasury was on the table. That should have been a conversation on the table because all the players were on the table. Okay. So I don't know, I don't understand where the Council of Governors is actually coming from. That is, we are supposed to hear that from the Treasury.
Okay.
Yeah.
Dr. Mwachonda, are you able to function without the clinical officers and the nurses?
Trevor, the answer is no. Because the reality is that we work as a team. We need nurses on board, we need clinical officers on board, we need laboratory officers on board, because when I see a patient, and that patient needs a diagnostic test or a laboratory test, that has to be done by the laboratory officer. If I'm in theater and I'm operating, I need the nurse with me. I need, and in most instances, we also work with the clinical officers and anesthetists in the theaters. So essentially, this is a team effort. So even as we are saying doctors are back to work, they're not able for the services that we offer fully. And so It's a matter of clocking in. You go in, you see what can be done and what cannot be done, and you wait, because even patients themselves are not coming, because the people who receive patients at the triage is the nurses before they do the temperature checks and all that. So the reality is that the health sector in the public sector is actually crippled. There are no services being offered, and this has to come to an end by resolving the matters. And just because we haven't gone on strike again, doesn't mean that the issues that the Council of Governors agreed to all the issues. Yes, they signed, Governor Ngwai, the HR committee chair, signed the document. The health committee chair and the Council of Governors chairman have declined to also sign the same return to work formula. So essentially, we are seeing a situation where the COG is playing games with healthcare workers. And the saddest thing, which is violation of labor rights in this country, is the sackings that we are now seeing across the counties. I mean, it is not helping anyone. In fact, if anything, the Council of Governors is now sabotaging the agenda on universal health coverage, because according to the universal health coverage agenda, and if you look at the reports and the assessments that were done towards the end of the year, is that the weakest link in UHC achievement in this country is the human resources for health. There is an acute shortage of healthcare workers in all facilities from level 2 all the way up to level 6. And so we need more personnel on board. So when the Council of Governors is now firing doctors, nurses, clinical officers, laboratory officers, and sending them home, they're basically sabotaging the UHC agenda. And I think this is where the national government now needs to come in very strongly, because this is an agenda that is supposed to not just help the country, but also help the citizens of this country, the average citizen who depends on the public health sector. And so when a section of government sabotages willingly and knowingly, then there's a problem in the country.
Dr. Mochonda, let's speak about that in a bit. You were actually one of the people who got that sacking letter. Were you reinstated?
There's been no reinstatement up until now. It's a matter that we are still discussing with them. They will have to reinstate. They have no other option, because even the way it was done was basically illegal. And that is how most of these sackings are illegal. And not just being illegal, it is basically violating trade union rights in the country. You cannot have gone through a process of conciliation, gotten a certificate of disagreement, gotten the go-ahead to go on strike, gone to court, and the court indicated that the strike actually was protected, and then a county government comes on board and just fires healthcare workers out of nowhere. I mean, out of the law, because the process that was followed was as per the labor laws and per the constitution. So that remains illegal according to us as KMPDU, and those letters will have to be withdrawn. And it's not just about me, it's about the doctors in that county, and not just the doctors in Mombasa County, but even the nurses in Kisumu that you saw were fired on the same day. And yesterday we saw clinical officers being fired in Kisii. We've seen nurses also being fired in many other counties. I mean, you cannot violate labor rights, which are constitutional rights, and then say that you actually want to help Kenyans. You're lying to Kenyans.
Okay. Panyako, are you concerned about these firings that is going on?
I'm not very much concerned, because those firings have not happened. They are what we call in law, they did not take place, so they are null and void ab initio. Because when you look at the reasons why nurses went out, one of them is a very high risk working environment, which is very infectious, and when they are sick, they don't have medical cover. So the working environment had become very unconducive, and it was not fit for work. And that one, according to the Occupational Health and Safety Act, Section 14, you as a worker, you have the right to walk out of that place you think is high risk, and the employer has by law supposed to bring a health auditor, which is supposed to be taken there by the Directorate of Occupational Safety and Health to certify that that place has become conducive for you to go back to work. And therefore, one of the remedies provided for in the law is that you cannot dismiss an employee who has left his or her place of work on account of the place being not conducive for working. And therefore, I am sitting pretty, knowing very well that what the county governments are doing is in direct violation of the Occupational Health and Safety Act. You remember when Dr. Kidero fired 64 nurses here in Nairobi because they walked out of Mama Lucy, they walked out of Pumwani Maternity Hospital for working in an environment that was not conducive. It has high risk and rate of infection was very high. Even the rate of maternal child death was so high. And so they said we cannot continue to preside over the deaths of our mothers and our children. So they walked out. Kidero sacked 64 nurses, and I promised Kidero that we shall sack you in 2017. And indeed, we sacked him. So we went to court. We stayed there for 3 years, and ultimately, the judge observed that indeed the situation at Pumwani Hospital were not conducive for working, and therefore, for these nurses to have walked out, they walked out within the law, and they were reinstated, and they were paid all their full salary. I am 100% sure that we shall have that verdict delivered. But I'm not still talking about the courts, because we still have an avenue for dialogue, the way Governor Oparanya said yesterday. But how do we dialogue? When Governor Oparanya is busy inaugurating village councils in the village, Governor Ongwae is busy demolishing structures in Kisii, and the strike is ongoing. They are not showing the seriousness of resolving these issues. And that's why, Trevor, I told you earlier that we have political systems that do not care about public health care system. Because for them, they go to Aga Khan, they go to South Africa. You had Governor Nyong'o saying that he went to California, treatment there. How many Kenyans can afford a private clinic, leave alone a private hospital in Kenya? How many Kenyans can afford that simple private clinic in the village run by a nurse? Not even run by a doctor. How many can afford? But here you have a governor whose healthcare system has collapsed. The only thing you can hear, I'll fire you tomorrow, I will sack you. If I don't have personal protective equipment, how do you expect me to go and work? When you tell them, let us have an agreement saying that, yes, we are ready to go back to work, but let the health auditor, as provided for in Occupational Safety and Health Act, audit my place of work. And if I went there and I find that I don't have personal protective equipment, I will not work. They say, no, we can't sign that one. Just go and work. If you fall sick, you will not have, no one will take care of your medical bills, to a harambe, to take care of yourself. And when you die, no one will take care of your young families. They will take care of themselves. So just work and die, and let us continue going to high-class hospitals, 7-star hospitals. We don't care about you. So we are saying, no, this healthcare system needs a serious conversation. The silence at the national government is defining what is happening in this country. It shows that we have political mandarins who do not care actually what happens to you and me as common mwananchi. And to me, if we have this thing, you know, when you talk about BBI, they start saying that you are a follower of so and so. I have my own brains. I am a Kenyan. I know what is happening. You are telling us today you don't have money for health sector. But you are telling me you have money to increase the number of senators from what they are today to more than 100. You are telling me you have the money to expand the executive. You are telling me you have the money that in the next election, for you to meet the two-thirds gender rule, you can even have 600 members of parliament. And yet you are telling us there is no money to make sure that Kenyans get the basic life services called healthcare services in this country. It means we have our priorities are upside down. So for me, is to call upon the president to come out clearly and resolve this issue. Secondly, we as health workers, what is it going to drive us to support BBI? We will definitely not be supporting BBI if it is not going to resolve issues of common management. And that issue that must be in BBI, that is addressing the issues facing common management, is the Health Service Commission. When Oparanya says that workers in the national government have never met salary, what is he telling you? He's simply telling you we need the Health Service Commission, so that the budget for healthcare system is not mingled and put together with the budget for building toilets in the village, for doing public participation and distributing to Wananchi. And yet when they go to hospital, they have no medicines, they have no health workers, have gone on strike. So the only solution we have is not even taking, I heard one of the viewers saying that we need to return the health sector to the national government. On the interim, I will support that. That right now health in Kenya is an ICU. Take it back to the national government shortly. But the lasting solution is to have an independent health service commission.
Okay. Wachira, how long are you going to hold on to this issue from where you stand?
I think the ball is squarely on the court of the employers, the 47 county governments. They know what they need to do to be able to end the impasse. But allow me to say this. I think we did a mistake as Kenyans. They say if you give problems to a person whose only tool of trade is a hammer, everything looks like a nail. So we gave a technical department like the health sector to politicians. And for every challenge, they look for a political solution. That is the problem we are actually having. So all we are seeing are just but symptoms of a bigger cancer called ineffective management of health human resources.
Yeah.
And we have been treating these symptoms. And without providing a cure for the main disease, which is ineffective human resource management. That is the biggest problem that we're having. And until we can be able to come together as a country and say that we know in 2013, the health workers went on a prolonged strike and they were asking for a framework in place to ensure that there is effective management of human resources. And we have seen over the years over 100 strike notices that have revolved over very minor human resource management issues, promotions, redesignations, delayed payments, and so on. Something that is very meager, and with good and effective human resource management, you could not actually be having these over 100 strikes that we have had in the counties. So if then we come to this realization, we are supposed to sit and look at the other critical sectors like the teachers, the police, and the others. And you can see that the drafters of the Constitution, realizing the critical services they offer and the need to have them continuous without interruptions, they ensured they have a body that 24/7 the whole year, they look at the welfare of the workers so that services cannot be interrupted in the name of a commission. Why did we then relegate the health sector, a very, very critical sector, and give it to politicians to be able to manage? I think it's a high time, now that there is a constitutional moment, that as Kenyans we should have a public discourse, a public conversation. And we say that we need to have a body that centralizes management of human resources for health to ensure that there is parity, there is effective management. Let me say this. Going forward in the next 20 years, if we are not going to do something here, we will have a total collapse of the health system. We will go back more than 30 years. What they are doing now, because of the political solutions to technical challenges, they are coming up with an employment policy of 3 years. Most of the specializations that we have range between 2 to 5 years. So if then in the next 20 to 30 years, we will not have anybody on permanent basis, that will mean you'll be employed on a contract of 3 years. Then you cannot be able to go back to school and specialize. So we will not have even the simple consultants that we have today, and you'll have to cross the borders to get that consultant. And that will mean that the quality of the healthcare that we are receiving is actually going to go down. We will not be able to guarantee Kenyans of the highest standards of health as is envisioned in the Article 43. And if we are to realize the agenda for the president, and I want to thank the president because I think he's the first to put health at the center of the prosperity of the country. But the UHC agenda will not be achieved unless we have a central body that will be ultimately responsible for the human resource management. You can imagine a situation where the CS Health, who I think by default is supposed to be where the buck stops when it comes to the health services, can actually assent to a document and then the county governments go back on the same. I think we need a situation where we can be very clear on where the buck stops when it comes to health services, and especially to health human resources, and only then can we then be able to guarantee the quality services, affordability, and access, so that we can give the UHC to Kenyans as it should be.
Let's bring back Mwachonda on this, and this is a question that will also go to Seth Panyako. It's from Engineer Lazaro Kanyambok. He says, Seth Panyako and Mwachonda should note down that abandoning patients at their hour of need is going contrary to their oaths. We are all aware of the selfishness with the people driving key ministries, but that shouldn't be an excuse. Mwachonda, I'll let you respond first.
Trevor, I empathize with Kenyans and really sympathize with Kenyans. And I'll always say this. The responsibilities. We have a responsibility to treat Kenyans and attend to Kenyans, but our leaders, political leaders, have a responsibility to ensure that our welfare is well taken care of. And let me use an example of the current situation we are facing in one of the counties, and at least Mombasa County, where your insurance has not been remitted for 6 months. Your loans have not been remitted for months, and the bank is now freezing your account. You're accruing extra interest because of non-remittance of your loans and defaultment of payment of your loan. And so that now affects directly the healthcare provider. So you want someone to wake up every day to come and offer service at great risk, and if they contract a disease, they're unable to pay for that treatment, and they're not even able to pay for it out of cash, because even the amount that they had in their account has been frozen, rather has been recouped by the banks. So it is not practical to say that you're abandoning patients, and yet you yourself have been abandoned by whoever is supposed to take care of you. So that line of thought, and I really empathize with Kenyans. I think Kenyans need to wake up and try and understand, listen to what we are saying, look at the situation, and then finally hold to account the leaders of this country. Because you cannot hold to account doctors and nurses who are also being sabotaged by the system. So the reality is that it is blackmail. When it gets to that, I say it is blackmail because you want us to give our all, including our lives, but no one is willing to compensate our families. No one is willing to take care of us in terms of insurance and even basic things like paying our salaries on time, and even ensuring that we have access to finances to support our families and support the societies and villages that we come, the societies and communities we come from, and then say we have abandoned patients. It is blackmail, Trevor.
All right. Panyako, this was also directed at you.
Yeah, Trevor, you see, I really have no better words to respond than what Dr. Machonda has already said. We did not take any oath. I did not take an oath of Florence Nightingale to go and kill myself. You see, from the time we went on strike up to now, we have lost 0 nurses to COVID-19. And I can tell you, if we were still working, we'll be talking about numbers that have reached even 40 nurses who have passed on. So this strike alone should show to the Kenyan people that actually we are dying from a place of work. There is also a decrease in the number of infections in Kenya. What does that one mean? It simply means that the nurses and maybe clinical officers to some extent have been working without personal protective equipment. And therefore, when they leave their place of work, they are carrying the virus and they infect people in matatus. And that's why the infection rate was very high. So what we are saying is that every person in this country has got a role to play. You cannot tell me that you do not, you took away. I want Kenyans to understand this thing clearly. Yeah. Our salary was taken away. Our medical allowance was taken away to go and establish what we call comprehensive medical insurance scheme, together with group life insurance scheme that was then being managed by National Health Insurance Fund. Now, those two things have been removed. As Dr. Machonda has said, you are being told now, you see, if you're a public servant and you have been paid salary under normal circumstances and you don't pay your rent, and your landlord or landlady comes and locks your house and throws your children out, throws your things out, or fortunately or unfortunately, if it's a very bad one, you saw another one trying to bring sewage and actually pouring in the house of a tenant during the COVID-19. If that landlord is very crazy and he bundles your family in the car, in the lorry, and throws your family at the gate of the hospital where you work, the government will dismiss you on account of embarrassment. Now, if now that is happening to us, because we don't have salary. In fact, in most cases, we go on strike because salaries have not been paid. If you are being thrown out because salaries have not been paid, if you cannot pay your medical bills, you have to beg. If you cannot service your loans, you have been taken to CRB, are we able to punish government? Can we dismiss government? We cannot do that. So what weapon has the Constitution and ILO Conventions number 98 and 87 given to workers? The only tool that we have, and granted by the Constitution of Kenya, Article 41 2D,
is to go on strike. And if you now want to take away that only tool of going on strike by dismissing health workers, dismissing workers who go on strike because they cannot dismiss government, then what are you telling us? Okay. Kenya is slowly drifting into a banana republic.
Okay.
A revolution is not started by 1 million people. We health workers, we are able to start a revolution in this country and take this country back to the people. Okay. Because when Kenyans are not getting healthcare services, this country is not with the people. Okay. It is with a few individuals.
All right. I want to give you all a chance to make your final remarks. Washira, I'll start with you.
Yeah, and I think I'll start with the same question. Yeah. And let me say that protecting lives should be seen in the broader context. If I'll be posing a risk to the patient who is coming to me, then by myself vacating that place, I'm actually protecting your life. And that is all we have been saying, that we have been infected, the working environment is of high risk, we are infected, and we are infecting our patients. So we are actually doing what our oath mandates us to do. I think I'll finish by saying this, that we clinical officers are ready and willing to go back to work. The employer is very hostile. We actually went back to work, but we were met with disciplinary measures. In some of them, they are actually lockouts. Our people were actually chased out of the workplaces. I'll say that Kenyans have a responsibility. Every responsible citizen have a responsibility to take their leaders to account. The power belongs to us, the people. We delegate it to the leaders when we elect them on the ballot. Yeah. The leaders are supposed to facilitate our enjoyment of the rights given under the Constitution, including the right to life and the right to the highest standards of health, which actually go together. We must ask those leaders that we send to office these questions. Why aren't you facilitating my right to be able to access those services? Because what the Council of Governors is doing today, and I agree with Dr. Mwachonda, they are sabotaging the very right that the Constitution has granted to Kenyans, that we granted to ourselves as Kenyans. We were not given by politicians. And so we must be able to ask the right questions, and we must be able to ask, even in this BBI moment. We have had a problem of the health sector for the past 7 years, but we are not seeing any solution within the BBI. Why are we avoiding the issue of the health sector? Why is it that we have to leave it to politicians to decide for a so critical sector in this country? Yeah. And then if we can be able to ask those questions, if Kenyans can be able to ask the right questions, I'm sure going forward we can have uninterrupted services and have the UHC that is going to make Kenya to even become a medical tourism destination as envisioned in the Vision 2030.
All right. Gentlemen, we have to leave it there for now because we run out of time. Dr. Mwachonda Chibanzi, Secretary General, KMPDU, Seth Panyako, Secretary General, Kenya National Union of Nurses, and Peterson Washira, Chairperson, Kenya Union of Clinical Officers. We'll see how this plays out. Is there any meetings that is planned for this stalemate to be resolved, Panyako? None. So how long is this strike going to stay then?
So even the meeting they were supposed to have on Monday never happened.
Never happened. Is there any other one planned?
We have been looking for the chair and the chair Labour Committee in the Council of Governors. They are not picking calls. We have done letters. They are not even answering to the letters. We are only seeing them address us through the media. And I think I want to say the same statement that the chair Council of Governors told us, that the good book says, come, let's reason together. Let them come to the table. Let us discuss so that we can avoid to have the health sector in this country collapse. Because Kenyans are really suffering.
Until they do that, the strike remains.
The strike remains.
Is that the same for the nurses?
The strike remains, but I know we have not run out of options.
Okay.
Yes.
All right. That's why we have to leave it for now. We're taking a quick break here on Daybreak. I see a lot of your feedback here. Let me read them really quick. Jacob Abere Matlala says, a system that fails to prioritize health of its people is death as its economy as well. What we are seeing between our medical personnel and government, both county and national, is a true picture of how industrial salary bargainings aren't respected as far as labor laws are concerned in this country. Bobo Wino says COG is responsible for this mess, not the national government via Oparanya derailing UHC, one of the big four agenda, and should be a wake-up call to the government to take over the docket. All right. We see here Baba Tadashi says governors are power hungry and they do not want solutions for the health sector simply because, one, they believe that they must manipulate the labor force at the county level and they seek health care from private facilities. That's where we leave it for now. When we come back, Waiga More is standing by live in Kampala. They go to the polls tomorrow. 18 million voters in 34,000 polling stations. It's deemed as a two-horse race between incumbent Yoweri Museveni and Robert Chagulanyi, who's also known as Bobby Wine. But there's one lady and 9 men contesting against Museveni. We'll cross over to Kampala live right after this break.